I want to share an experience of something I experienced about 3 to 4 weeks ago. It was a very aberrant, very unusual behavior from one of my patients, actually. So that's even what makes it more frightening and more unacceptable. The patient can inappropriately touch their doctor within a clinic setting. That's something I found to be very ridiculous. Now, about 3 to 4 weeks ago, I had a gentleman come into my consulting room. And that gentleman came with pain around his groin. And of course, I did the consultation, examined him, and then, of course, prescribed some medication for him. And then printed off that prescription. Consultation went well. And then he stood up. Obviously, consultation had come to an end. 10 minutes consultation or 20 minutes consultation, because it was a double appointment, because this patient needed a translator. So I made use of the services of a translator online over the phone. The language line, service, spoke with this patient, took a history, examined this gentleman, and I felt he was having what we call epididymochitis, which is an infection, causing an inflammation, in the testicles and surrounding tissues. That was my assessment. Prescribed him a course of antibiotics, and then consultation came to an end. So as is my usual practice, once my consultation comes to an end, to signal to the patient that, okay, it's time to leave, I typically stand up from my seat and walk towards the door, and obviously most people understand, okay, yes, the consultation is over, it's time to leave so that, the doctor can see the next patient. So I did that in my usual habit. Patient got up, picked up his jacket, wore his jacket, and then reached out to shake me. I didn't see anything wrong with that. You know what I mean? Some patients might be, expressive of that gratitude when a doctor has taken their time to properly assess them. So I felt, yeah, why not? I gave him a handshake. Now, after I gave this gentleman a handshake, he pulled, it's like, gave him a handshake, he pulled me into himself, like slowly, and gave me a kind of hug, which I felt was quite uncomfortable. But again, as I said, some people might be very expressive of gratitude when they think a doctor has gone, the extra mile to do his normal job. It's not like I did anything extra. I just did my normal job of properly assessing him, reaching a diagnosis, and prescribing the medication I believed was best for him at that point in time. So it's not like I had done anything extraordinary. I had just done my normal assessment and treatment of my patient. So he gave me that hug, which felt uncomfortable. So I kind of, just wriggled myself out of it, went towards my desk, picked up the printed prescription which he had left on my desk. And as I handed that prescription over to him, something insanely ridiculous happened. This gentleman reached out and touched my penis. That was something I found unacceptable. You know what I mean? It's something that I've never in my wildest imagination envisioned or imagined would ever happen to myself or any other person in a clinical setting for that matter. So I didn't even know how to react at that point in time. You know what I mean? I didn't scream. No. I didn't think it was a screaming incident. So at that point, my brain didn't process it as something that needed me to start screaming, help, help, help. So I told him, I looked at him in a very, you know, in a way that would have suggested, what the hell are you doing? You know what I mean? Gave that very stern look to communicate, what the hell have you just done? In a clinic setting? How dare you? You know that look he gives on, how dare you? And this gentleman, uh, you remember he was already putting on his jacket or still reaching out to pick up his jacket from the chair, holding the jacket. This gentleman came a second time to come and inappropriately touch me again. And I backed away from him and I told him no. And you would not believe what this gentleman said. He asked me why. Can you imagine that? He asked me why. And that was what made me even realize that this gentleman doesn't even realize that what he's doing is inappropriate. For him to have the audacity, the temerity, the impetus, the audacity to ask why. I was so shocked. I told him, because it's wrong. It's inappropriate. You shouldn't be doing this. You shouldn't be doing this. And then he left. He left my consulting room. Obviously, consultation had finished. I opened the door. He left. I didn't scream. I didn't shout. But what I did immediately was I went into my chair and I was in total disbelief. I sent a message immediately to our operations manager who was on site, to the operations manager. The operations manager came quickly as she was in total disbelief. She rushed to my office, sat down, and asked me what happened. And I narrated what happened. She was in utter disbelief. She told me something she's never imagined can ever happen. It's something that's never happened throughout her stay working at my GP practice. Something that has never happened. And then we went upstairs and had further discussions with one of the practice partners, one of the senior GPs. And at that point, we agreed that the best thing to do first is to make sure that patient is removed from the practice register, which means that patient will no longer be a patient at my GP practice, at my place of work. That was the first thing that needed to be done immediately. And that patient will be transferred to another practice where there are special ways that have been put in place for people who have acted inappropriately, either physically abused, sexually abused, verbally abused, staff, difficult patients who are unruly. They have they've designed some structure in place to be able to rehabilitate per se, or to safely deal with such patients over a period of time to ensure that other staff do not come to harm. We also determined that it was very important to report that case to the police if I wanted it to be reported. And yes, I agreed. So the manager went ahead, reported that case to the police. The police called me, I think a day or two after, checked on me, made sure I was well, and invited me to give a statement, which I did. I haven't heard again from them. I don't know how long again it's going to take. I appreciate that the police will be very, 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 very busy, and they might have more, life-threatening emergencies, maybe robberies, and more serious crimes, community crimes that they might have to deal with. I completely accept that. I appreciate that. Obviously, I'm still looking forward to hearing from them because I really want to see to the end of this. It's something that was so inappropriate. It's something that shouldn't happen to anyone at their place of work or even outside your place of work. It was a very inappropriate sexual touch. from a patient, which shouldn't ever happen. So this is something that obviously I've moved on. I've resumed work. I've gone back to work. I'm thriving. But that experience obviously would forever be in my mind. As long as my brain continues to function, as long as my memory continues to function, it will always be there. Something that would always come up at one point in the other. So it's something. It was something that I just just let me share this, because it's something. This knowledge would probably help someone to be more prepared if they find themselves in similar positions in the future. If someone tries to inappropriately touch you, or abuse you in any other form, verbal abuse, verbal assault, anything at your workplace, you should know how to deal with it. Don't try to keep it to yourself. Don't try to keep it to yourself. Just looking to make sure there's no snake, a shadow casts on my eye. I just wanted to make sure nothing was moving on this tree, like a snake. So it's for you to know that you don't have to keep it to yourself. You know what I mean? Report it to the appropriate authorities. Take it up. Don't try to hide it. It's not shameful to talk about things like this. It's important that we talk about things like this so that information goes out. People are better prepared, and potential perpetrators would know that they shouldn't try this. It's unacceptable. Okay? If you're someone who thinks about this, that yes, it's completely unacceptable. It's not something that is pardonable. Okay, I don't know how far the police will take it, but I'm not sure if they will say maybe removing him from the practice is sufficient judgment. I look forward to hearing from them to see how far, within the confines of the law, this case can be taken. If you haven't subscribed to my channel, do not forget to subscribe to this channel. I talk about different things. I'm a medical doctor. I'm a general practitioner in the United Kingdom. I talk about public health matters, how we can safely keep ourselves healthy. I talk about those things. I'm also keen on things related to tech. If you go through my channel, you realize that previously I did some videos on SQL and basic to intermediate Python. I just recently, last week, made a video on, was it last week? Or actually, yeah, this week actually, last week, today is Sunday, made a video on, introduction to website design. Okay, HTML and CSS. And you'll be seeing more videos on HTML and CSS. You'll be seeing videos like this, where I'll be standing outside and just making videos on things I think are important in life. It might come as advice. It might come as me sharing certain experiences. I would say leave a like, subscribe to my channel. It helps this channel grow. What it does is that it communicates to the YouTube code or algorithm, as we popularly call it, that this video is important. When you leave a like, when you subscribe, when you share, then obviously it communicates to the algorithm that the video is important, and the video will be recommended on the screens of other YouTube users. So as you do that, I want to say thank you very much. Have a great day and stay safe.